Hello everyone, it's Dr. Jawad. Thank you for tuning in to my channel. If you haven't done so already, just 4 things. 1, the subscribe button. 2, the like button. 3, the bell notification. And 4, leave a comment or ask a question. I will be more than happy to answer very, very simple questions when you put them down there. People have asked me in the past, where do I recommend buying my products from, my supplements? And now I have a link to a store. It's in the notes down below. Full script. You can click on that link and it'll take you to my online store. Now there's over 300 brands there. So when the question of branding comes up, this is where I can say do your research. Find the brand that suits you best because there's over 300 different brands for you to choose from online. So thank you very much for supporting my channel. I appreciate it and enjoy the video. Thank you.
Hello everyone, this is Dr. Jawad. Thank you for tuning in. Again, if you haven't done so already, 4 things: subscribe, the bell notification, like button, and also leave a comment. When I did this video, when I edited, I realized it's really, really long. So this is a shortened version of just the side effects of statins. And I would like to hear them. I'd like to hear your side effects. So in the comment section down below, and also to my other viewers, would love to hear your side effects of statins and what you did to overcome that. So thanks for watching.
Okay, so here's a magic question. What are the side effects of statins? Now, with my research, there's plenty more side effects from statin drugs. Now, the thing about statin, it's like a trickle effect. You don't know when it's going to happen. I've had patients say, well, I've been on it for a while and I still don't have any side effects that I know of. And then all of a sudden, out of the blue, it's a disaster. So sometimes the statins could affect people immediately or it may take some time. But don't forget, the common side effect that I've experienced with statins is muscle aches and pains. But that's when they've been taking it for a while. But what about all the other things that cholesterol does for the body that statins affect? Okay, so who's really at risk? Who is the high-risk people, like the characteristics? Typically, who increases the risk of side effects of statins are the female gender. The older you are, older than 80, the older population. Anybody with a medical condition, kidney disease, liver disease, hypothyroidism, and also people who are smaller in stature, meaning they're thinner. They're thinner, not lean thin, but I'm just saying thinner because typically with skinny fat, they may be thin, but they'll usually have malabsorption syndrome. Besides that, what activities are being done that will increase the risk of statin side effects? Drinking alcohol. Alcohol does damage to the liver. So do statins. So you're increasing the chance of having hepatitis or any type of liver damage by drinking alcohol and taking a statin. In addition to grapefruit. Grapefruit inhibits the metabolism of a lot of prescription medications, and statins one of them. Cholesterol medications. Sometimes people are taking 2 medications at once, 2 or 3 cholesterol medications at once. Like 1 is not good enough, so you have to stack 2 and 3. Antibiotics. I know people go on antibiotics for a short amount of time, but by being on the antibiotics, it'll increase the side effects of a statin. Antifungals. Warfarin. Warfarin will increase the side effects of statins. Heart medications. Cyclosporine. Polypharmacy. The more medications you take, it boggles down the liver. It affects the liver because the liver is a phenomenal organ that metabolizes stuff. It turns the inactive vitamins to active. So by taking a lot of medications, it hinders the effects of the liver. And then there increases the chances of getting what's called non-alcoholic fatty liver disease. And just makes the liver more boggy. So let's go over some side effects. Now, again, I always encourage the viewers, do your research. I just came up with 10. I found about at least 30 of them before I said, okay, I'm just gonna do the top 10. So do your research on statin medications. And also, in addition, I'm not going on this video, but things you could take to avoid the side effects, but also, is cholesterol really that bad? Lowers the amount of vitamin K2 in the form of MK4 that's stored in the kidneys. Now, one of the things that vitamin K2 does, that breaks down that calcium buildup in the arteries. So by taking a statin, it lowers the amount. It puts the kibosh on the job of vitamin K2. And they say with statins, it's going to lower the chances of heart disease. No, with statins, it increases the chance because it lowers the amount of vitamin K2. What does vitamin K2 do? It naturally removes the plaque buildup in the arterial system. In addition, it lowers testosterone levels in both males and females. Remember, cholesterol is needed to produce our hormones. And for females postmenopausal, when your ovaries shut down, everything is being produced where? In the adrenal glands. So by taking a statin, it lowers those levels because it starts off with testosterone and then it converts to estrogen. 3, it increases the risk of type 2 diabetes. It increases your blood sugar levels. It decreases levels of CoQ10, ubiquinol levels. Now, CoQ10, it's needed for mitochondrial function. Every single cell in our body has what's called mitochondria, and one of the functions of the mitochondria is to produce ATP, your energy currency. So going upstream, what statins do, it decreases the level of that being produced, and this is where you get a lot of the muscle aches. And your heart, don't forget, is a muscle. It beats 365 24/7. 5, it raises your liver enzymes, ALT, ALP, AST, GGT, which when you get blood work done, they're not really testing the cholesterol levels, because if you're taking a statin, your cholesterol should be normal. They're looking at the liver enzymes because the statin medications pulverizes the liver. And if you get increased liver enzymes, it's a sign of irritation, inflammation, and you don't want that. You don't want the chances of increase in chances of having hepatitis. It decreases your energy levels. Wow, it decreases your energy levels because it decreases the levels of CoQ10, ubiquinol, which is needed for energy production for the mitochondria. So it decreases energy levels, then you'll increase exercise fatigue. I've known patients that can't walk 2 blocks without feeling fatigue because they're on a statin. Number 7, lowers DHEA levels. Remember, DHEA, females postmenopausal, is produced in the adrenal glands. And the DHEA makes testosterone. Okay, let's go a few up. So what it does, it lowers testosterone levels. You see how all this works? So now it lowers the DHEA levels, which is produced in the adrenal glands. By the way, what produces DHEA? Let's go upstream, the start of the domino. Cholesterol. Cholesterol starts that whole cascade. And if you're putting a block on that cholesterol, this whole domino effect doesn't work. Number 8, worsens memory. Maybe it increases the risk of dementia. Remember, what is the brain made out of? Fat. What's your nervous system made out of? Fat. You need cholesterol for that function. So if you're blocking the function of cholesterol, sure, I know a lot of 50-year-olds who feel like they're 90 and 80 with the brain. They forget. Okay, number 9, increases the risk of having shingles. I thought this was amazing. Now, coincidentally, they're coming out with for shingles. Wow. If you're on a statin, it increases the risk of having this. Why? Because remember, cholesterol is good for the immune system. Number 10, increase the risk of, this is for men, erectile dysfunction. Why? Because sex hormones are made from cholesterol. If you're blocking the inflow of the necessary constituents to get Mr. Happy up, yes, and again, it's not all at once. It may be in due time. So when Mr. Happy doesn't want to come out to play, it could be the effects of, there you go. Thanks for the viewer who wrote in. That was a good suggestion. I appreciate it. If you have any questions or comments, lay them down below. If you want a consultation, which I always would love to, www.totalwellnessdepage.com. Book me for a consultation. Let's talk. We can do a Zoom call, phone call, and just get you better health. I appreciate it. Hey, thank you very much for watching. Be good.